In this video, you'll see the techniques to use when performing a complete assessment of a neonate. For efficiency, the examination sequence clusters steps by body region, proceeds from head to toe, and saves potentially upsetting procedures for the end. In this video, you'll see healthy neonates with normal findings. In your clinical practice, you may note the same findings, normal variations, or abnormal findings. To obtain clues to potential problems, gather history information before examining the neonate. This information includes antepartal history, obstetric history, maternal and paternal medical histories, and the family's socioeconomic and demographic factors. It also includes an intrapartal history that covers type of birth, maternal medications received, neonate's condition at birth, 1 and 5 minute APGAR scores, and any neonatal problems. Before beginning the examination, check to make sure that you have all the equipment you'll need and that you have adequate lighting. Then consider your approach to the exam. Plan to keep the neonate warm, handle him gently, keep him calm, and adjust the order of the exam as needed. For example, if the neonate cries, postpone auscultation and note the quality of his cry and his color, respiratory effort, and facial symmetry. If a gestational age assessment also is needed, do it during or after the physical examination. Because these assessments share many techniques in common, they will be marked by this logo during the physical examination. To begin the physical assessment, undress the neonate on a radiant warmer or examination table with an overhead heating element. While the neonate is quiet, assess his general appearance. Note his breathing pattern, overall skin color and characteristics, posture, including body symmetry and spontaneous position, and muscle tone, including flexion and spontaneous movement. Also, check the neonate's affect, which should be alert and responsive. If the neonate cries, characterize his cry, which should be strong and lusty. If the neonate is quiet, check his respiratory rate by counting abdominal movements for 1 minute, because the pattern can vary greatly. Normally, the respiratory rate is 40 to 60 breaths per minute. Next, use a warmed neonatal or pediatric stethoscope to auscultate the apical pulse for a full minute. Normally, the heart rate is 120 to 160 beats per minute. Also, note the point of maximal impulse, which should be located lateral to the midclavicular line at the 3rd or 4th intercostal space. Then take the neonate's temperature using an axillary thermometer. Using a platform balance scale, weigh the neonate to the nearest 10 grams. A full-term neonate should weigh 2,500 to 4,250 grams. Next, measure the neonate's length. For accurate measurement, extend his legs by holding his knees together and pushing them down until the legs are flat. A full-term neonate should be 48 to 53 centimeters long. Using a tape measure, assess the neonate's head circumference by measuring around the occipital area, just above the eyebrows at the widest point. Also measure the neonate's chest circumference at nipple level. The chest circumference should be 2 to 3 centimeters smaller than the head circumference. Inspect the neonate's skin, which should be pink to pinkish brown. Observe for dry, peeling skin, lanugo, and vernix. Also note any birthmarks, rashes, or lesions. Then palpate the skin's texture and turgor. Remember that Mongolian spots are a common variation in normal pigmentation in Black, Asian, and Hispanic neonates. Next, assess the shape and symmetry of the head. noting any molding or overriding of the cranial bones. Also observe for cranial swelling and fontanelle bulging. Then gently palpate the fontanelles, suture lines, and cranial bones. The fontanelles should be flat, and the suture lines should feel like ridges and be movable. Next, note the positioning and symmetry of the neonate's facial features. They should be in proportion, symmetrical, and fully formed. While the neonate's eyes are open, observe the eye's size and shape, which should be symmetrical. Eyelids, which may be puffy. Irises, which should be even-colored. Corneas, which should be bright and shiny. And sclerae, which should be bluish-white. In a darkened room, use the bright light of the ophthalmoscope to elicit the pupillary light reflex, in which the pupils constrict equally in response to the light. As the neonate looks at the light, check for the red reflex. A red glow should fill the neonate's pupils. In a dark-skinned neonate, however, the red reflex may normally appear pale or grayish. Next, watch the neonate's eyes as they track a moving light. Strabismus and nystagmus may be normal. Now inspect the size, shape, and alignment of the ears, noting any skin tags or pits. Also, palpate the auricles, which should be flexible. Now inspect the neonate's nose, which should be midline and symmetrical, and may be slightly flattened. Be aware that a black or Asian neonate normally has a flat nasal bridge. Next, watch the neonate breathe while quiet. You should see no nasal flaring or narrowing of nasal passages. For the mouth examination, inspect the lips, which should be symmetrical and pink, mouth, which should be in the midline and symmetrical, tongue, which should be proportionately sized, frenulum, which should allow normal tongue movement, and mucosa, which should be pink and moist. Next, test the rooting reflex. Brush the neonate's cheek near his mouth. He should turn his head toward that side and open his mouth. To test the sucking reflex, place your gloved little finger gently in the neonate's mouth. He should suck on it strongly. Use your gloved finger to palpate the hard and soft palates, which should be continuous. To inspect the neonate's neck, lift his shoulders and let his head lag. Normally, the skin is symmetrical, has multiple skin folds, and displays a full range of motion. Next, palpate the trachea, which should be midline, lymph nodes, which normally are not palpable, and thyroid, which is difficult to palpate unless enlarged. You should detect no masses or lumps. Then palpate the clavicles. You should feel no crepitus or lumps. When examining the chest, begin by inspecting its configuration. The thorax should be rounded and have a prominent xiphoid process. During the first few hours after birth, the neonate's precordium may be active due to a thin chest wall. Next, note the neonate's chest movement, which should be symmetrical. You should see no labored breathing or retractions. Then inspect the nipples and breast tissue, which normally align. Palpate for breast enlargement and a scant white discharge, which usually resolves within a few weeks. Using a neonatal stethoscope, auscultate breath sounds systematically, comparing sides. Listen over the neonate's interspaces, not over his ribs. You should hear no adventitious or abnormal breath sounds. Then, using the diaphragm, auscultate heart sounds, starting at the point of maximal impulse. Auscultate in the aortic area, pulmonic area, tricuspid area, and mitral area. Using the bell, auscultate heart sounds in these areas again. Expect the heart sounds to be relatively loud because of the neonate's thin chest wall. You may also hear a grade 1 or 2 systolic murmur in the first 2 to 3 days after birth. Next, auscultate the neonate's abdomen to assess bowel sounds, which should be heard in all 4 quadrants. To continue, note the size and shape of the abdomen, which normally is round, symmetrical, and protuberant, and moves with respirations. Also inspect the umbilical cord stump. At birth, it should be white and contain 2 umbilical arteries and 1 vein. By 10 to 14 days after birth, it should fall off. Before palpating, flex the neonate's knees and hips with one hand to relax the abdominal muscles. Use your other hand to check the muscle tone, which should be soft. Then lightly palpate for the liver's edge, 1 to 2 centimeters below the right costal margin, and the spleen tip at the left costal margin. Also palpate all 4 quadrants systematically to detect any masses. Next, place one hand under the neonate's flank and press down with the other hand to palpate the kidneys. Also inspect the femoral area, which should have no bulges. Then palpate the femoral pulses and inguinal lymph nodes. Now inspect the arms and check their range of motion and muscle tone. In a full-term neonate, the arms should be well flexed and should move smoothly and symmetrically. Next, assess for scarf sign by drawing the neonate's arm across his chest. In a full-term neonate, the elbow should not reach midline. Also check the arm recoil. Flex the neonate's arm for 5 seconds, then extend them by pulling his hands and releasing them. A full-term neonate's arms should flex briskly and fully. Carefully inspect the hands, which should be normal-colored, have nails that cover the nail beds, and have no extra fingers or webbing. Note any palmar creases. Next, assess the square window sign by flexing the neonate's hand on his forearm between your thumb and index finger. The angle between the forearm and palm should be nearly 0 degrees in a full-term neonate. Then test the palmar grasp reflex. Place your index fingers in the neonate's palm. His hands should grasp your fingers tightly. While the neonate holds your fingers, wrap your hands around his hands, pull up slowly, and note the head lag. Normally, head lag is minimal. Finally, palpate the radial and brachial pulses with your index fingers. The pulses should be regular and strong. Also, palpate the radial and brachial pulses simultaneously on each side of the body. Normally, they are equal in strength and similar to the femoral pulses. Now inspect the legs and assess their range of motion and muscle tone. The legs should be well flexed and should move smoothly and symmetrically. Next, perform Ortolani's maneuver. To do this, flex the neonate's hips and knees. Then abduct both legs simultaneously until they nearly touch the table. A palpable clunk indicates hip dislocation. Immediately perform Barlow's maneuver. From the abducted position, bring the knees together and push laterally on the upper inner thigh. A clunk indicates an unstable hip joint. With the neonate's pelvis flat, gently move one foot close to his head. In a full-term neonate, the heel-to-ear maneuver creates an angle of 90 degrees or less between the foot and head. Next, move the neonate's knee toward his chest and extend the leg gently. The popliteal angle should be less than 90 degrees in a full-term neonate. Now note the alignment of the feet and toes. Also inspect the feet, which should have no extra toes or webbing. Also observe the soles of the feet. A full-term neonate should display deep creases over the entire sole of both feet. Finally, check the Babinski reflex by stroking the side of the foot from the heel up and across the ball. The great toe should dorsiflex. The other toes should hyperextend and fan out. For a male neonate, inspect the penis, which normally is 2 to 3 centimeters long and has a meatus centered at its tip. If circumcised, the glands should look smooth. If not circumcised, do not try to retract the foreskin. Also inspect and palpate the scrotum. You should see deep rugae and should feel testes on both sides of a pendulous scrotal sac. For a female neonate, inspect the external genitalia. Normally, the labia majora are swollen and cover the labia minora and clitoris. With your thumbs on the labia majora, push laterally. The hymen should appear thick and may have a hymenal tag. You may see a vaginal discharge, but should find no bulges. Now evaluate the neurologic system. First, rotate the neonate's head slowly from side to side to assess the doll's eye reflex. Normally, his eyes shift to the opposite direction. Now lift the neonate under the axilla and hold him facing you at eye level. The neonate should be able to straighten his legs and trunk when upright and to stay in your hands without slipping. Then turn the neonate around while holding him upright. Elicit the stepping reflex by touching one foot lightly on the edge of the table. The neonate should make walking motions with both feet. To assess the spine, hold the neonate upright. Inspect the length of the spine, which should be straight, and the gluteal folds, which should be symmetrical. You should see no sinus openings, protrusions, or tufts of hair. Next, assess the truncal incurvation reflex by pressing firmly on one side of the thoracic spine. The neonate's pelvis should flex toward the stimulated side. To assess the rectum, place the neonate prone on the table. Observe the buttocks, which should be firm and rounded with no masses or lesions. Then spread the buttocks and inspect the anal opening, which should be patent. To complete the exam, perform procedures that are likely to cause crying. To take the neonate's blood pressure, use a Doppler ultrasound device. Also perform an otoscopic examination. If a parent is present, he or she can hold the neonate and calm him during this part of the examination. Pull the pinna straight down and insert the otoscope. The auditory canal should be patent, and, if visible, the tympanic membrane should be whitish, highly vascular, and intact. Finally, elicit the Moro reflex by suddenly dropping the neonate's head back. He should extend and abduct his arms and open his hands, and then flex his arms and close his fists. After examining the neonate, review your findings with his parents and answer any questions they may have. Keep in mind that your sensitive, thorough assessment can increase the parent's confidence and peace of mind and help the neonate grow into a healthy, active child.